So what are we going to do if we come across a choking adult? So if our friend here is choking, firstly, I'm going to ask the obvious. Are you choking? Can you cough? And if they're choking, they're not going to verbally respond. They might be going blue, they're going to look panicked, their eyes might be bulging. So once I've established that they're choking, I'm going to call for help. Then I'm going to do 5 back blows. So I am going to support the person at the front so that they don't push them forward. And I'm going to use this ball part of my hand and we're going to go between the shoulder blades. Now we want to be firm. So 1, 2, 3, 4, 5. Hopefully that's going to dislodge it. If it doesn't, then I'm going to go on to abdominal thrusts. So we are going to make a fist and hold it in the abdomen here and then cover it with our other hand. This used to be the Heimlich maneuver. We're not allowed to call it that anymore. I think the family didn't want us using that name. So now I'm going to pull in and up. So 1, 2, 3, 4, 5. Now you're here, the air is coming out. And that is because we are contracting the diaphragm. So hopefully that air is going to push the object out. If that doesn't work, I'm going back to doing 5 back blows and 5 thrusts, and I'm going to alternate. If it's a child, I'm doing the same. My pressure will be lighter because I do not want to damage their internal organs. If this gentleman goes unconscious, which is possible, I'm going to let them fall. We don't catch people. It's far too dangerous to us. And in this instance, the fall itself can sometimes dislodge the item. So people have fallen at home and their lives have been saved by that fall because it dislodges it. One of the most common places for people to choke is a bathroom. So people may be out having a meal, they get embarrassed and they go off to the bathroom, and that actually can mean that they don't get the help that they need. Babies are completely different. I'm not going to cover that, and none of this covers formal training in any way, shape or form. And I would only ever advise face-to-face training for anything healthcare related. So you can get hands-on, ask questions, and then you're going to be really empowered to deal with these situations if they arise.